Hello friends, how are you doing? Welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. And in today's video, I've got a guest with me and he is Dr. Ambuj MISHRA, sports and respiratory physiotherapist working in Medanta Hospital, New Delhi. Now, he is here with us to let us know the role of physical therapy in management of COVID-19 or any kind of respiratory disorders. He'll also share some of the tips with us, how we can keep our lungs, our endurance fine in this crisis time, and also his tips would be helpful for anybody who is suffering from any kind of respiratory conditions like asthma or is bronchitis, COPD, etc. So stay tuned with me on this video as you are going to learn a lot from him. Hello Dr. Ambuj, how are you doing?
I'm good, ma'am. It's all good here.
And how about the COVID situation right now?
In our hospital, it's controlled. It is under total control.
Great.
Lots of patients have been discharged.
Okay, that's nice.
Yeah.
Overall, Delhi has improved much, right? Compared to the initial days. Yes.
Yes, ma'am.
Right. So let's start today's conversation. So as we discussed earlier, we are going to talk more about our lungs and role of physiotherapy and exercises and how we can make sure that our lungs stay healthy. But before we start on, just let the audience know about yourself.
I'm Dr. Ambuj from Medanta, the Medicity. Basically, I'm from Allahabad. My hometown is in Allahabad. So I'm working here from last around 6 years. I can say more than 5 years, 5.5 or something. I'm not remembering. So basically, I have done my master's from IMR College, Ghaziabad, under Dr. Shagun Agrawal sir. So I have done my master's in sports medicine. I have worked in various national sports tournaments, national championships, and lots of marathon events. As I'm in Gurgaon and I'm in Medanta. So Medanta is most of the time Medanta is medical partner in marathon events. So that is, and I have achieved. According to me, it's a big thing for me to share. I have shared a stage with Gautam Gambhir and Pankaj Dhuan. Gautam Gambhir, everyone knows about him. Gautam Gambhir is nowadays MP, but he is also ex-cricketer of Indian cricket team. Pankaj Dhuan is the CMO of RP Healthcare. So we try to orientate public about acute injuries and consequences in a awareness program, or I can say it was a launch event of Move India. So I have earned some awards, like I have won few academic awards because I was a great scholar during my study days. So I have won 6 national academic awards and I have won 2 clinician awards till the time.
Oh, that's
Till
awesome.
the time.
That's awesome. So I think today's audience is going to really get some good amount of knowledge about the topic that we are going to discuss. So
Yeah,
let's
I hope.
first start me asking you this question is how different the situation has become after COVID in terms of you seeing the patients. Like what all things you do take care while you are seeing the patients, what all things you keep in mind.
First thing, we need to take care about our self-protection, our PPE kit. That includes our gown, that includes our mask, that includes our shoe cover, that includes our hand hygiene before watching the patient and after watching the patients, or before getting exposure of the patient, in terms of any fluid or in terms of anything. So we need to take care of self first.
When it comes to, like as you said, like you have to take care of yourself, like that's where the role of PPE comes. But can you just tell me in general what kind of patients are coming right now and what kind of breathing difficulties that exist among patients with comorbid situation and people who have low immunity?
So first of all, I need to say, ma'am, very clearly to all the general population or all the healthcare, even I can say all the persons, everyone, that it's a beautiful quote. So if one's life is life is in breathe, life is in always in breathe. So one who half breathe half lives. So it's very important to take care of our lungs and take care of our respiratory unit. So firstly, everyone should know about what are the pre-morbid respiratory conditions, which includes basically lower respiratory tract infections and upper respiratory tract infections. In upper respiratory tract infection, there will be infection to your nasal cavity, infection to your pharynx, infection to your larynx. In general words, I can say infection to your nostrils, infection to your sinuses and tonsils. But LRTIs are more severe, and these can be life-threatening, which includes pneumonia, which includes bronchitis, asthma. These are the things basically. So if talking about the symptoms, the first symptom, frequent symptoms people can experience is shortness of breath. They are experiencing shortness of breath at rest, during activities, during any physical activities, during any exercising. They can experience during stair climbing also, or they can experience during if they can wear tight clothing, then can also experience shortness of breath. And in some sort of positions like tying the shoelaces and picking some object from the ground. So this is the basically shortness of breath. And second thing people are experiencing is shallow breathing. Shallow breathing is it's like running short of oxygen. So it's running short of oxygen kind of thing, and this is basically drawing minimal oxygen into the lungs. And we can see it's a lack of full expansion of our lung, I can say. And there's also people are experiencing rapid breathing also. In rapid breathing, it's like lack of expansion always, and running lots of like this activity, frequent respiration, which totally it's basic, the symbolic of lower respiratory tract infection. So people should very careful about these respiratory conditions, and they have to do some activities. And in further I'll explain everything.
So do you feel the people who are healthier, like who have got good immune system, who are younger, who are more involved in physical activity, they have got better breathing capacity compared to the people who have got some pre-morbid condition?
Yes, ma'am, definitely. Definitely. It varies. Definitely it varies. Someone who is not doing activities, someone is not doing physical activities, and someone is doing great physical activities. There's a huge difference in respiratory care, respiratory health.
So now this takes me to the next question. When it comes to a COVID-19 patient, so at the end, coronavirus or else COVID-19 is a viral infection like any other viral infections, right, which impacts your respiratory tract. What kind of different symptoms would be seen in a COVID patient compared to a patient who is having other viral infections?
Basically, when COVID-19 can cause range of symptoms. Fever symptoms like fever, symptoms like dry cough. People can experience fatigue. People can experience sore throat. Myalgias are there, and headaches are there. But if you're talking about particularly respiratory problems, then people are experiencing, again I'm coming, shortness of breath is the first symptom. Shortness of breath. People can experience dry cough. People can experience, they are running short of oxygen. In medical term, we are saying like hypoxemia. It's a lack of oxygen in the blood particles. So if people get investigated through chest X-ray or CT chest, then chest X-ray shows opaque and glassy view, and CT chest shows quite bad images. So these are the initial symptoms, and these are the symptoms people are experiencing. Corona is a close relative of SARS and MERS. SARS is a severe acute respiratory syndrome, and MERS is the Middle East respiratory syndrome. These are the past contagious infections. And COVID-19 caused by SARS-CoV-2. It's a family of coronavirus. And further, if it progresses, it further leads to ARDS, and if it's uncontrolled, then it leads to death also. So if you're talking about the pathway of this disease into human body, in general language, I can say infection starts with common cold and mild flu. So once infection starts, it damages some part of the lung. We known as alveoli, where the gases exchange takes place. So everyone knows that primary function of lung is transferring oxygen into the body through blood particles. So if damage occurs to COVID-19, so then there must be some debris in the form of damaged epithelial cell, and there must be some accumulated infected fluids. So that those debris and those accumulated infected fluid can thicken the lining of alveolar wall where the gases exchange takes place, which further causing the difficulty in the breathing. That's why we feel running short of oxygen, lack of oxygen to the internal organs. So if lack of oxygen to the internal organs happens, then it impairs the function of the organs and it deficit of the body. So now our immunity comes under a scanner. Definitely. If anyone has stronger immunity, then their immunity is going to fight. But if anyone has weaker immunity, then the body is unable to fight with the virus. As immunity's first response is to destroy the virus and its replication and duplication. So, but if an individual has weaker immunity, then the body is unable to fight. And then body is unable to fight, then definitely body is unable to stop the virus. And then this aggravates the crisis basically, which further leads to severe infections like pneumonia. And then further, I already said ARDS and death can also occur. But we Indians are so fortunate that we have great recovery rate than other countries. We have 35% recovery rate. And if you talk about the death rate or mortality rate, it is around 3%.
So now this brings me to the next question about the role of physical therapy or physiotherapy in management of COVID-19, like where the physiotherapists come into the picture, and also the role of physiotherapist in any other kind of respiratory conditions as well.
In COVID, I'm talking about if COVID-19, role of physiotherapy starts in subacute condition, I can say. If he starts breathing exercise in acute condition, initially, once virus enters, then we promote virus to go inside. It's like if I'm doing deep breathing exercise and virus is in my nasal cavity or oral cavity, I'm breathing in and pushing virus into my lungs. So we start physiotherapy from the subacute conditions, like after 2 to 3 days, with some viral therapy. If viral therapy is going on, some antibiotics are going on if the person needs. But if he starts breathing exercises, if he starts expansion exercises, it's having huge effect. So if you're talking about the COVID-19 physiotherapy protocol, it's only breathing exercise, we can say. In severe cases, we start chest physiotherapy, where the lots of pneumonic patches are there. When patient is on ventilator, then we have to do chest vibration. We have to do some segmental, some postural drainage kind of thing to improve his or her chest.
And many researchers have said that postural drainage is effective in people who have developed pneumonia due to coronavirus. So is it true? Is it being practiced? And how effective?
Yeah.
In severe conditions, where CT shows quite bad images, it totally fibrous alveoli are there. But in some shots, we clear the lung. Some shot, we are not saying we clear all the lungs, we clear all the areas. But in some shot, people can experience relief. If talking about other conditions, it's very useful. It's very useful, fantastic.
Right. So, what's the role of physiotherapy when it comes to other respiratory conditions like bronchitis or pneumonia, emphysema, whatever it is, like, or else any heart condition, or else any post-surgical condition as well? What is the role of a physiotherapist? Because the reason I'm asking this is people know physiotherapist for the role of back pain management. They know the role of physiotherapist in neuro rehabilitation, but very few people know the role of physiotherapist in ICU, in post-surgical situation, in cardiorespiratory disorders?
Yeah, it's having huge role. I'm not saying because I'm physiotherapist, but it's having huge role in all the conditions which you have mentioned. If patient is not on ventilator, then breathing exercises, spirometry, coughing, supported coughing is too beneficial. Even mobilization of the patient having huge role. But if patient is on ventilator, then we are doing chest physical therapy regularly. We are doing suctioning, we are doing oral, nasal suctioning for clearing the patient's secretion with postural drainage. And even we are mobilizing patients when patient is on ventilator also. So this is the early mobilization of patient in critical care unit. So this is having huge role. It's having huge role. It's giving patients huge relief, I can say.
So now let's move out of the ICU and let's say for a general population or as a normal person, how he comes to know that his lungs are healthy or weaker, or any test that you can suggest that a person can do on himself and find out or figure out that, okay, there is some problem with my lungs and I need to see a physiotherapist or else a doctor and figure it out.
Ma'am, to get to know about lung health, we can do few tests. Some are significant, some are insignificant, but we are doing. If we are addressing general population, then it's okay. Like we are doing 1 minute hold test. If you're able to hold your breath 1 minute till 1 minute, then it's all okay. We assume it's all okay with your lung. We only assume. So, but this validity of this test is under question, and we can't rely too much on it. We have very significant tests like we are doing in critical care atmosphere. So this is peak expiratory flow meter. There's a portable device easily available on online market. So it's a peak flow meter. It gives you standard data of peak expiratory flow per minute. So normal value is around 400 to 700 per liter per minute, and it varies. It varies through age. It varies through your sex. Like if you are female, then it can be. It comes lower. Like if 407 liters are for men, then it would be like maybe 300 or 300 to 600. So these devices basically measures how well your lungs are and how well your respiratory muscles are. And an important part of this device, it's managing and preventing asthma and its attack also. So it gives you proper idea that how well are your lungs able to move out the volume. So this is quite significant test, I would suggest.
So after test, what are certain breathing exercises that you believe is good for a general well-being of a person? What kind of breathing exercises a person can do every single day? Any examples you would love to give?
Now, deep breathing exercise, full expansion exercise, I can say, in full expansion, I can demonstrate it. Full expansion exercise, it's like if I'm doing like this and just inhaling, deep inhaling, inspiring deep, and then hold this to 5 seconds, and then again blowing out through my mouth. So it gives you full expansion of your lungs. Some certain other exercises like we are doing apical breathing also, which protect our upper part of the lung. We give lungs to some kind of resistance during inhalation phase, and exhaling proper from mouth. While exhaling, we need to relax our lung. This is for upper part, and for lower part we are doing like this. This is the lateral segmental exercise. We are giving resistance during inhalation phase. While blowing out, lung should be relaxed. So these are the 3 exercises I would suggest to people. And rest, I have seen your video on your YouTube channel, HealthQ. So I was so impressed. People can see that video also on your YouTube channel. You explained wonderfully there.
exercises. Now, any kind of nuggets of advice that you would like to give to general people, audience who are watching this? The reason why it is important right now to pick up this topic is because somewhere we have to live with this virus for a long period of time. This is not going to go sooner. And
Yeah, definitely, ma'am.
now
Yeah.
slowly we have to start moving out, right? How many days we will stay in this lockdown? We have to move out for some other purpose, so always we are at risk of catching or is containing this virus. So how we can ensure that we can stay away from it as much as possible? Definitely taking covering our mouth, or else using sanitizer, face, like avoid touching the face. So these are the basic measures, definitely. But yeah, immunity, as you said, plays a very major role. So that's why we had a Dr. Ashwani, who came and he told about the immunity with the help of food.
Mhm.
And that's why I've got you today to tell about the exercise part and some other respiratory care advice or else tips that you can give from your end to the patients or else people, so that they can stay away from coronavirus.
First thing we all need to do, we need to prioritize our prioritize our lung health, because it gives you life. We need to quite protect them. We all take, most of us take our lung for granted. So if you're talking about the tips, I can say, in terms of exercises, everyone can do aerobic exercises, aerobic activities. Aerobic activities includes walking, running, jumping, even jumping on the ropes during lockdown time. It helps, it helps in the, your lung function efficiently. You can do Pilates also. Pilates activities are there. Planks you can do, which builds your core strength and toning of your breathing muscles. So, as you mentioned already, breathing exercises are so useful. So, you can also use, there's a device also coming in the online market. There's an inspiratory muscle trainer, IMT, we are saying it, and we are effectively using the patient in the ICU also to train the muscles. So this device name is Power Breathe. If you search on the Google, it's a Power Breathe. It's improved to the breathing muscle and their stamina. So this device works by creating resistance. You breathe in. This strengthen your breathing muscles by making them work harder. And it's same like dumbbells for your respiratory muscles. You can use technology, have a regular check on your regular monitoring, like you have regular check on heart rate, respiratory rate. You have some gadgets like Fitbit kind of things. We have lots of different mobile apps, and smart watches are there. So if you're talking about respiratory rate, the respiratory rate in normal healthy adult is at rest around 12 to 18 per second. And also we have to watch our posture. We have to watch our posture. People need to stay active. Don't be so lazy. Need to maintain their normal body weight. They need to stay hydrated. And one thing last add here, that laughing is a great exercise to increase the lung capacity. So don't forget to laugh.
Yeah. So since you come from sports background, anything additional that you would like to suggest to the people who are from sports background and are not able to do their regular warm-ups, they are not able to play regularly, sitting at home, but still they can do something on their respiratory end so that their endurance doesn't go down. It stays with them. So that once they are back to their play, they are able to get back easily.
I mean, Gurgaon these days, there's a one event is completely, continuously going on. Indoor running. Indoor running. Indoor running in this lockdown period will help to maintain their endurance. Even jumping on the ropes, I have already mentioned, to improve the endurance. So these are few things which sports background people can do. And if sports players are there, they have proper regime. So they have proper regime to follow. If you're talking about extra precautions, also there are. I have already mentioned, boost your immunity first. We need to maintain proper social distancing. Proper hand hygiene should be there. Frequent hand washing. We should wear masks outside our home, especially. We need to eat healthy, which is rich in antioxidants. We need to adopt active lifestyle. Stop smoking, please. And most important is to stay happy and laugh a lot and worry less.
Thank you so much, doctor. Thank you so much for this valuable insight. Really, there you add a lot of information, value, and knowledge, including me. Many things I learned from you today. So, thank you so very much for joining me on this channel and sharing your experiences. I hope that you stay safe while you are taking care of other patients. And hopefully, we can meet soon again on any some other topic where we can talk more in detail about some other conditions as well. Thank you so much for having me.
Definitely, ma'am. Definitely, ma'am. Everything is going to be okay and fine. Everything is going to be okay and fine. Stay safe, stay at your home, and save our nation. Thank you, everyone. Thank you so much, ma'am.